Hi, I'm Dr. Lazzara, and I've recorded this video to provide some instructions to our patients who are wearing rubber bands. We basically wear 3 types of rubber bands in our practice, and we will go over each of those individually. The first and the most common type of rubber band we wear is called a Class 2 elastic, and it's for patients with overbites to reduce the overbite. We wear a Class 2 by connecting the rubber band from the lower in the back to the upper in the front, as we see here. The important factor when you're wearing a Class 2 rubber band is we do not want to overcorrect. We want to wear it to the point that the front teeth just couple sort of nicely together, fitting together, but not at all edge to edge. So we don't want this, where we see the front teeth fitting together edge to edge. We also don't want this, where again we have this edge to edge relationship in the front because the Class 2 rubber band has overcorrected the bite. We are looking for something like this, where the front teeth couple together perfectly with just light contact between the upper and lower front teeth. Once you reach this point, you can wear your rubber bands only when you sleep until we see you again. This is called a Class 3 rubber band, and it is for patients who have an underbite or a tendency towards an underbite. It connects from the upper and the back to the bottom and the front, and what it does is pulls back on the lower teeth, pulls out on the upper teeth until we reach that same point of sort of ideal coupling in the front. So with a Class 3, as with all rubber bands, where we want to end up is just with that gentle contact between the upper and lower front teeth. So once you reach this point, just wear them when you sleep until you can come back in and see us. We don't want this, where as you can see, it's subtle, but if you look closely, you see how different it looks from our other images of that ideal coupling in the front. This patient is wearing Class 3 rubber bands to such an extent that the overbite is actually increasing a little bit. This is what we call overcorrection. So please stop before you get to this point. Finally, we wear some vertical rubber bands as well, or what sometimes in the practice you might hear us call triangles. And triangles go up and down, typically in the front, and they just help to close any open spaces in the bite in the front. These images are certainly a bit exaggerated. The good thing about triangles is they're fairly self-limiting. It's hard to get a lot of overcorrection with these, but again, at the point at which you feel that you've reached that sort of ideal coupling in the front, just switch to wearing them just when you sleep, and we'll see you back as soon as we can. So again, this is what we want. Ideal coupling in the front where the upper and lower front teeth are fitting together perfectly. This is our goal really with all 3 of the rubber bands that we've learned about today. There are certainly some patients out there wearing rubber bands that don't fall into these 3 categories, period. We have identified you through our chart audit process, and we'll be following up individually with specific instructions. Certainly, if you're concerned about monitoring your own rubber band wear, please do not wear them. We're not expecting you to be orthodontist or orthodontic assistants here. So if you're unsure, please just don't wear them, and we will figure it out once you can come back in. If you have questions, please call us at the office, 904-270-8750, because we're happy to help. And then finally, take some photos with your smartphone and send them to us at info@lazzaraorthodontics.com or drlazzara@lazzaraorthodontics.com, and we can offer some feedback. And I will give some instructions on taking those smartphone photos on the next slide.